let's say that somebody comes to the Nash ER, which is under new management relatively recently and infinitely more efficient.
It's Wake. I mean, we partner with Wake, WEPA. Isn't it WEPA?
Yes, WEPA.
And they're wonderful.
Absolutely
I mean, the feedback
wonderful.
we're getting, and I'm glad as two physicians, because as a person in public, I hear it all the time. But I'm glad that y'all are seeing it as physicians there too.
Oh, we clearly do. And in fact, from an orthopedic point of view, I take care of almost all the hand injuries at the hospital. And I will get calls from these highly skilled people, and especially their PA team is wonderful. They're just amazing. This is a photograph of what I saw. This is what I did. Do you approve? And almost always they nail it perfectly.
Yes.
The level of care that's provided there, and for people to get triaged in and out and sent over to the office is perfect. That's from my perspective.
Yes.
From your perspective, if they come to an emergency room, they often need imaging studies like they do for me.
Yes.
And Nash's ER has modernized its emergency room facilities in that they expanded X-ray and CAT scan and MRI capabilities right attached to the emergency room.
Exactly.
So you can get in and get your emergency studies done immediately and not compete for the people who are inpatients and not compete for people who've scheduled outpatient MRIs.
Right.
If you need an emergency study, you're going to get it.
Yeah.
You're going to get it in a timely way. And you're going to get it read perfectly, and you're going to get it read immediately by a radiologist.
Yes.
And then, so they get this study, and then let's say you meet them there, and you determine that they need surgery. They're going to go to a modernized preoperative area that's currently being modernized and expanded.
Exactly.
Right?
Yes.
To meet the increased demand for the wonderful services that people like you and your team are bringing on.